the truth is, more protein may not always be better. Endurance exercisers are kind of notorious for being high carb, and whether this is evidence-based or just something that they kind of stumbled onto, I'm not really sure. But if most people are doing that and getting good results, then you would tend to think that higher carbohydrates are better. All right, so getting into, sort of, I guess, a lot of people's questions around carbs are around athletic performance. Carbohydrates good, carbohydrates bad. Is more protein always better? So we found an interesting data point that actually seemed to be a really good, solid study design, and looked at the gut microbiome with different types of diets in endurance exercise. It seems like there's a lot more studies in general looking at endurance exercise. And the truth is, more protein may not always be better. Endurance exercisers are kind of notorious for being high carb, and whether this is evidence-based or just something that they kind of stumbled onto, I'm not really sure. But if most people are doing that and getting good results, then you would tend to think that higher carbohydrates are better. But what did this study show? What did you find interesting about it?
There's a couple things in this study. There is really kind of 4 groups of people, but in individuals who so there's 2 groups. There is a high protein group and there is a high carb group. And I believe the breakdown was the same fat percentage in both groups. And then one of the groups had 30%, 30% protein. One of the groups had 10% protein, and the carbohydrates were 40% and 60%. So not a huge difference in the amount of carbs, but a significant difference in the amount of protein, 30% versus 10%. In one of the groups that was higher carb, so 60%, lower protein, their performance significantly improved.
Yeah, and most people would consider 10% protein to be a low protein diet, even by looking at the RDA standards. Like that's a very small number of calories coming from protein. So it may be more of an accurate name here to say, does let's say, modest protein versus low protein diet, how does that affect exercise performance? In the study design here, they had people on their normal diet, and then they had them do their normal training. And then they did the intervention diet for a week, which for most endurance athletes, I speculate, would be higher carb at baseline. So maybe these people weren't actually eating 30% of their protein from calories. So probably a net increase in protein, but the study doesn't give us that data, unfortunately. And what they used was the time trial to exhaustion test. And their sort of format for this was they had these people run 10K, which seems like quite a challenge for myself. I think of that as like, wow, that's really something. And then after the 10K, they have this sort of 95% VO2 max time trial where they see how long they're able to sustain this. And those that were switched to the high protein group, their performance was decreased by about 23%. Those that were randomized to the high carb group, they had about a 6 to 7% improvement in their performance time to exhaustion. So I thought that was interesting. And the study kind of postulates this is all modulated by the microbiome. I don't know whether that's correlation or causation. Maybe they just have more glycogen stores being on a higher carbohydrate diet. And they were able to complete the endurance trial and also the time trial. I'm not super familiar with the nuance of endurance exercise as a field, but I think that there are probably multiple mechanisms at play there, not just, the gut microbiome as a sole driver of these results.
Yeah, parsing out the correlation and the causation could be fairly difficult. I do think it's interesting that they looked at the gut microbiome, but reading the full text of the study, I could not find any information regarding which carbohydrates were consumed. So were the carbohydrates, did they include resistant starch, prebiotic fiber? It was hard to tell what if they looked at what specific carbs were consumed, or if they chose specific carbs for the different groups to utilize, then that could tell us more about their effect on the gut microbiome.
Yeah, and that would be relevant because we know that some of these things are going to affect things like the gut microbiome diversity, which trending towards higher protein, 30% protein in this case, led to decreased diversity. Now, it may have been that these athletes are sort of adapted to their usual diet. And if this trial was carried on for, let's say a month, Like, would you see that sort of cancel out as the gut microbiome adapted and it was just sort of an interruption of their usual homeostasis that led to the performance declines? I don't really know, but it's an interesting study that's out there.